Good afternoon, everybody. It's 2 o'clock. Thanks for joining us for the briefing today. We'll go ahead and get started. On today's briefing, we have Milwaukee Mayor Tom Barrett, Milwaukee County Executive David Crowley, Dr. Ben Weston, Director of Medical Services for the Office of Emergency Management, and Marlena Jackson, Interim Commissioner of the Milwaukee Health Department. Mayor Barrett, you're starting us off today.
Well, thank you very much. As some of you may have seen in the morning newspaper, the National Guard made an announcement that because we're seeing a greater breakout or greater incidence of COVID-19 in other parts of the state, they're starting to make arrangements for us locally to take on more of the load. And I want to say a couple things about that. First, I am immensely thankful to Governor Evers. I'm immensely thankful to the National Guard for partnering with us throughout the last few months. Their assistance has been phenomenal, and they have been an incredible public servants in helping us move forward. As some of you may know, if you look at the situation in Wisconsin right now, and we're not in a good situation because at this point, I think over the last 2 weeks, I think we're still number 2 or number 3 in increase in outbreaks. Most of those are outbreaks that are occurring not in the city of Milwaukee, not in Milwaukee County, but in other parts of the state. In fact, when I was looking at the analysis earlier this morning of the cases per capita throughout the state of Wisconsin, Milwaukee County ranks roughly 49th out of the 72 counties in the outbreak of cases. I think that that's due in part to the mask ordinance that we have here, to the fact that people are really paying attention to what they're doing. And we're seeing, again, numbers that are dramatically worse than Milwaukee outside of Milwaukee right now. So it makes sense for the National Guard, which is essentially going to be deployed only through the end of this year unless Congress acts. And I want to take a minute and talk about that. As we move forward in our conversations with the state and with the National Guard, the intent is to have more of the activities taken on by us. That doesn't mean that that is going to be a cost that's going to be borne by our local property taxpayers, because we simply don't have the resources to do that. There still is CARES money, and in our conversations with the state of Wisconsin, they've made it clear to us that they're going to continue to underwrite the cost of this testing, but that they need to get their National Guard members in other parts of the state. So what we're going to begin doing is doing the training for our individuals. So we really have begun working on a plan to transition our community testing as state health officials are looking to deploy National Guard members across the state. As I said, we have been incredibly fortunate to have National Guard members here since May, and they have performed thousands of tests. I personally cannot thank the National Guard enough for its support to our city during the pandemic. So our overall plan is to maintain capacity and ease of testing at sites throughout the city. So we're working again with the National Guard, with local stakeholders as to where the best locations for those sites will be. So we will be doing this at the same time we are ramping up our flu clinics and continuing to support our federally qualified health centers in their testing efforts by helping them to winterize their structures. So now we're going to be focusing on the seasonal flu as well as COVID-19. But we're working to ensure that Milwaukee has community COVID-19 testing options available to residents throughout the county so that we can maintain the capacity needed to keep our community safe and prevent the spread of the disease. The details are still being finalized, so I have nothing concrete to report today, but we will continue to update you on our progress and provide more details as they become available. So now just sort of a snapshot as to where we are with the National Guard. On Monday, September 28th, there were 1,007 people tested at UMOS. There was 536 people tested at Custer, so over 1,500 people. Last week's total was 8,200. That's very, very solid. That has an indicator, that has an impact on our key indicators for the last week. We are now at 2 greens, one for testing and care, 2 yellows, one for PPE and tracing, and our first red since July 2nd for cases. So again, we know that there is an issue, although as I said, our cases are not growing as dramatically as they are throughout the state. It still is reason for concern here. There's no reason for anybody to say, we got this. This is under control, because clearly it's not. When you look at where our numbers are compared to other states, clearly it is not under control here in the state of Wisconsin. The troubling data that we are seeing is that our cases indicator went from yellow to red. What we are seeing now is a significant trend in cases. Several weeks ago, and maybe as late as early last week, we were at an average of 4.9% positivity rate. That was 2 weeks ago. And last week we were at 6.4 positivity rate. Last week we continued the upward trend, and unfortunately, we're now at an 8% positivity rate. Again, this is, if you look at the rest of the state, I saw the headline that said parts of the state were, maybe for the state as a whole, we're at over 20%. But I don't want to get near those numbers. I don't want us to get any higher than 8%. And I want us to drive the 8% number below 5%. I want to share some wonderful news on our safe vote drop boxes that I received from the Election Commission. As you may know, we have 15 absentee ballot drop boxes that are available throughout the city, and they're proving to be very popular among our residents. The commission shared with me that ballots are being returned by thousands daily. So thank you very much for doing that. What we're going to do is work to make sure that we've got a thermometer so people know how we're doing as a community. But I want to give my thanks to everyone who has planned ahead to ensure that their vote is counted in the November election. And with that, I think I turn it over to County Executive Crowley. County Executive.
Thank you so much, Mayor Barrett, and thank you for your leadership. And as we continue to talk about testing, Milwaukee County, we definitely support the efforts to uplift no barrier COVID-19 testing options. I mean, this is so we can continue to keep our county residents safe, especially residents in historically underserved communities, and mitigate the spread of this disease. COVID-19 cases across the state are skyrocketing, as many of us know. We each have to do our part to keep ourselves, our families, and our communities safe. We need to stay vigilant as this pandemic continues to goes on. And I know many folks have COVID fatigue, but we have to remember that there are simple things that we could do to keep ourselves safe. And that's to remember the 3 W's: wear a mask or a face covering in public, wash your hands, and watch your distance. We know the pandemic is having an impact on mental health as well. So safe social interactions are important so you can feel connected with friends and loved ones. We'll hear more from Dr. Weston and Commissioner Jackson on this in just a few minutes. But we're also doing everything that we can to address COVID-19 in this 2021 Milwaukee County budget. The pandemic has only intensified the need for county services. The county's budget will be released this Thursday, October 1st. And as I've mentioned before, we are facing a $42.5 million gap. And thanks to an existing structural deficit we've been combating for years, that's only been exacerbated by this pandemic. Our community needs are growing, and the revenue required for us to deliver services to meet our community's needs is continuously declining. And as it relates to COVID, with this budget, we will invest in equity. We know the health of our community has been severely impacted by this pandemic. And we know that it's had a disparate impact along racial lines. And we, as Milwaukee County, will channel our limited resources upstream to areas that elevate health and enhance Milwaukee County's sustainability as it relates to our fiscal situation. We can continue to provide this critical service in the future for our communities that most need it. And that's the position that we want to continue to be in. I mean, COVID-19 has made it even more imperative that we rethink how we spend our money. And I'm eager to share later on this week when we introduce our budget. Also, we're going to remind folks, particularly business owners, about the Milwaukee County Small Business Recovery Initiative grant program. These grants are designed to support businesses that have been adversely affected due to the COVID-19 pandemic. Grant amounts will range anywhere between $7,500 to $20,000. These grants are supported with CARES Act funding. Priorities for these grants will be given to businesses that include a letter of support from a member of the Ethnic and Diverse Business Coalition. And please remember the deadline to submit an application is this Thursday, October 1st at 5 p.m. So if you want to learn more about the program, please visit Milwaukee County's webpage. It starts with county.milwaukee.gov, and you can find more information on our website. With that said, I would like to turn it over to Dr. Weston for an update on our numbers.
Thank you, Mr. County Executive. Good afternoon. So first to our numbers, we've had 28,829 confirmed cases of COVID-19 in our community and 428 individuals who've died. I typically try to balance the positive news with the more troubling news during the situational update, but unfortunately there's not a lot of good news today, particularly when looking at the state level. Wisconsin is certainly in a very difficult position. And this is most pronounced, I think, through two key metrics: percent positivity and hospitalizations. We've seen the state of Wisconsin hit nearly 28% positivity over the weekend. We've now settled back to about 22% today, but these are extremely high levels. And likewise, the COVID-19 hospitalizations in the state are increasing extremely rapidly to 640 hospitalizations yesterday, far higher than the previous peak of 440 back in April. Locally here in Milwaukee County, while we are not seeing the same extreme numbers, we are seeing similar troubling trends. We've increased our percent positive from around 5% to around 8%. And our hospitalizations have similarly increased from around 70 a few weeks ago to 124 as of today. We're unfortunate to be a state of such high concern, in particular at such a challenging time with relation to COVID. With Labor Day interactions and school, particularly universities and colleges reopening, those are now showing up in our case counts, in addition to the challenge of colder weather arriving, forcing people indoors. And now we enter the fall, a time that we knew would be extremely difficult for managing COVID burden. All this puts us at a substantial disadvantage. That means we must be more vigilant than ever with mask usage and with physical distancing. Additionally, with colder months coming, the concerns over physical distancing turning into social isolation become even more acute. Discussions have started to pop up on creating what is referred to as a social bubble, as a method to stay safe while spending time with those outside your household. So whether you realize it or not, you may have already created a social bubble and worked through many of the inherent challenges. It may be the one family on the street that your child plays with, or the babysitter that you have come into your home. These are usually careful, pre-thought out arrangements of individuals with whom you interact. The size, the design, the necessity of social bubbles is certainly going to be dependent on your individual situation. So while a family of 5 may be able to make do with fairly minimal outside groupings, those who live alone or those maybe with a single child might have increased needs for closer social interaction. So to make these bubbles as safe as possible, it's important to have honest and frank conversations with those you consider grouping with. What is their approach to mask wearing, approach to physical distancing? Are they going to school? What other activities are they involved in that involve interactions with other people? And certainly once you have multiple overlapping social bubbles, they become far less protective. So we all know that the safest approach is certainly to stay home, maximize physical distancing. This can be very challenging for many of us. So carefully thought out and planned social bubbles are a way to help get through the isolating challenges of the pandemic, while still keeping a close eye on safety. In the end, these are certainly individual decisions as you work to keep yourself, your family, and ultimately your community as safe as possible. Finally, with the trends that we're seeing, it's so important, as the county executive said, to remember the 3 W's: wash your hands, watch your distance, and wear a mask. And as far as testing, if you have symptoms, if you have had close contact with someone diagnosed with COVID-19, or if you're referred by a public health or healthcare provider, please come to one of our testing sites. You can dial 211 to reach one of our 16 health system and community health center testing sites in the county, or you can visit one of the 2 current National Guard community testing sites. Thank you very much. Stay safe, and I will hand it over to Commissioner Jackson.
Thank you, Dr. Weston. Just to do another formal interview without my mask, I think last week myself and the former Commissioner, Dr. Kowalik, were masked up. So by way of introduction, I'm Marlena Jackson, the Interim Commissioner of Health for the City of Milwaukee Health Department. Excited to serve in this capacity, and I look forward to continuing this very important work. I want to just provide a little bit more insight in regards to the social bubbles by first acknowledging that mental and emotional health are just as important as our physical health. We know that COVID-19 pandemic has created a lot of uncertainty and anxiety and know that these feelings are widespread and they have affected us all to some degree. Whether we are in this pandemic together, and we will get through it and get out of it together. Social connections can help us mitigate the depression. It can help us mitigate the mental and emotional stress that we're all feeling. And by creating your social bubbles, it allows us to physical distance while still providing the connectedness that we know we need as humans. You want to make sure when you think about your social bubble that you trust the people that you are interacting with. Make sure that their values match your values. If you are not going to that large party, people in your individual bubbles should not be going to the large party. If you're avoiding large social gatherings, the people in your bubble should be avoiding large social gatherings. This is making sure that you and the individuals in your bubble are on the same page when it comes to all of the steps that help to mitigate and to decrease the spread of COVID-19. Remembering that anything that the person does that's in your bubble that increases the risk for them, increases the risk for you and your family. Additionally, physical exercise is another way to really deal with seasonal depression and mood changes. You can walk with your social bubble, you can jog, you can bike. Really take an opportunity as the weather cools down to get out and enjoy the fall weather, to enjoy the changings of the seasons, which also help again with dealing with depression and mood disorders. Lastly, you want to make sure that your social bubble, that the individuals within it are not traveling outside of your community, not traveling outside of your home, except for essential trips that are needed. Lastly, make sure that within your bubble, you are really having honest, frank conversations about expectations and guidelines, understanding that if we overlap and if in some ways we pop our bubble, that the risk of COVID-19 increases. Thank you so much.
Thank you, Commissioner Jackson. We do have our first question. It comes from Derek Rose at WISN 12. This is for Mayor Barrett, Dr. Weston, and Commissioner Jackson. In a White House COVID report on August 30th, Wisconsin was in the yellow zone for cases and ranked 26th in the nation. 1 month later, on September 20th, Wisconsin was in the red zone and second in the nation. However, in the August report from the White House, there were specific recommendations to wear masks to help slow the spread. In the September report, there was no mention of masks in the recommendations, even though the cases got worse in Wisconsin. Was it responsible to leave out or eliminate that recommendation on masks?
Dr. Weston, I'll let you go with the totally non-political answer first.
Sounds good. So for the non-political answer, I thought this was going toward why are cases so high in Wisconsin, which I think ties into the question as well. So I think there's a number of reasons why we're seeing such high numbers of cases. Certainly we've seen higher numbers specifically with young people as a result of colleges and universities. But more recently we've seen what we've talked about time and again, that young people don't live in isolation. It's now starting to certainly spread much wider than just that individual demographic. As far as the general questions about masks, without getting into politics, I don't think we've had a media briefing in the last, 3 or 4 months where everybody on it hasn't talked about the importance of masks. So I think everybody on here firmly believes and the science firmly points to the fact that masks are one of the key elements in slowing the transmission of COVID-19.
So I'll chime in with a little bit of the politics. If someone said to you, would you be willing to do something that could help other people and would do no damage to you, I think the vast majority of people will say, sure, if I can help somebody else and it's not going to hurt me, why wouldn't I do it? That's the perplexing question here, because this has gotten so political. And I'm going to go back to what I've said before. I don't understand why we don't make this more of a patriotic cause where everybody agrees. If we all do this, we can help other people and not hurt ourselves. But for some reason, and this is America in 2020, the decision was made to make this one of the biggest political issues of the year, which to me is just insanity. So to answer your question directly, I don't think it was responsible to leave that out.
Our next question comes from Meg Jones at the Milwaukee Journal Sentinel. With the rising number of cases, will the field hospital at State Fair be opened?
So I'll tackle this, and I think it loops into the next question as well, as far as how we're doing for hospital capacity. So maybe I'll take those together if that's all right. I think that as a state, hospital capacity is looking to be challenging. We're seeing skyrocketing numbers of hospitalizations in the state of Wisconsin. Locally in Milwaukee County, we certainly have seen increased numbers of hospitalizations. I can only speak for Milwaukee County, and I'll say our hospitals have worked very closely together, coming up with surge plans. What kind of beds can they transition over if they have sicker patients? How can they maximize the capacity in each of their hospitals? And we do have what Mayor Barrett referred to as an insurance policy, which I think is a great way of thinking of it, the alternative care facility that helps us to overflow if needed, so that our citizens know that if they need to be hospitalized, there'll be a place for them to go. As far as whether it's used at this point and whether it'll be opened, we'll certainly see what comes with surges and hospitalizations. We're seeing concerning trends right now. So certainly happy to have those surge plans in place and the alternative care facility standing ready.
And I continue want to, this is maybe sadistic or masochistic, I continue to want at some point to be criticized for having that facility there. But as Dr. Weston said, we have seen an increase in hospitalizations, certainly throughout the state, a dramatic increase in hospitalizations. We have seen an increase here locally. We have not had to go to the State Fair site yet, and I hope we never have to go to the State Fair site, but I continue to be happy that the State Fair site is there in case we need it.
Our next question is from Mark Stevens at CBS 58. This is for Commissioner Jackson related to contact tracing. Have city contact tracers seen similar incidents like that in Washington County? COVID positive and symptomatic people continuing to interact out in public.
I have not seen or heard any individual situations like that with from our contact tracing team. What I can share though is that generally speaking, we know that essential workers have to go to work. And I think that it would be naive of us to think that all individuals in the city and in the county have jobs where they can stay home and work remotely. So I think in what we have seen in regards to contact tracing is that people who are symptomatic are getting tested. The employers that we are working with have been very cooperative in helping and supporting their employees. And so overall, I think it's been a very collaborative effort. And I haven't heard of any individual cases of that happening.
Thank you, Commissioner Jackson. Are there any other questions that the media would like to place into the queue? We do have one more from Sharon Bajenda. In terms of hospitalizations, are we red, yellow, or green for Milwaukee County?
Sorry, so in terms of our hospitalizations, we are green currently in that less than 10% of our patients or our hospitalized patients are COVID positive. Less than 10% of the beds in usage are COVID positive. So we're certainly seeing upward trends, so we'll have to keep an eye on that number. But right now we are in the green for hospitalizations.
If there are no further questions, thanks everybody for your time today. Thank you, Mayor Barrett and County Executive Crowley, Dr. Weston, and Commissioner Jackson. We'll see everyone back here on Thursday.
Thank you, Sydney.
Thank you, Sydney. Thanks, everyone.
Thanks, Sydney.